that I'm aware of.
Okay, so we can assume that the Delta variant is being labeled COVID-19. That's fine.
Correct.
And every variant from here on out will just be labeled COVID-19. But the media is telling us...
Nothing changed from before Delta variant came out and now in the charts or in the patient symptoms or anything. Nothing changed. There's no exacerbation once they started using the term Delta variant. Those patients have not changed at all.
What about the number of sick people? Have the number of sick people changed?
No.
Okay. So have you seen an influx of patients recently?
No, no. The influx I have seen is since the vaccination rollout, and it's more vaccination-related injuries, blood clots, cardiac issues, neurological issues, balance issues, cognitive issues, aggressive behavior, encephalopathy, things like that are very different from the previous COVID.
So the patients that are in your hospital under your care right now, the majority of them are, in fact, not COVID patients, but they are vaccine-injured people?
Yes. Yes.
Do the providers report these adverse events, these vaccine injuries, to the vaccine adverse event reporting system?
I have not seen one instance where they have. In fact, when staff approaches doctors about this, whether it's noticed by the staff or noticed by the patient's family, they're completely dismissed. I have not had one doctor acknowledge anything I have said when a patient's family or I've noticed that it's been around the time of vaccination. They're completely dismissed.
Mentioning a vaccine injury to a doctor is falling on deaf ears. They don't want to hear it. You're not allowed to talk about that.
They will not acknowledge. They will actually stop you mid-sentence. I mean, it is completely blatant.
Okay. So this is all blowing my mind. I'm sorry. I'm just trying to take all of this in. We suspected it is, but it isn't at the same time because we have suspected this all along. So would you articulate that the cases being labeled COVID-19 and then by the media translated into new Delta surge, that those patients are actually patients that are presenting with symptoms from this vaccine, these shots?
Absolutely. The staff that's aware, because now it's kind of, you know which staff is aware of what's going on or acknowledging it and which staff doesn't. We almost label it. The Delta variant is the vaccine injuries. That's what it is. It's common knowledge around the staff that is aware of what's going on or paying attention or not in denial.
And the people that are bringing this to the attention of the doctors, it's falling on deaf ears. They're cut off mid-sentence. How many people that you work with, would you guess, percentage-wise, are going to refuse this shot?
So far, about 50%.
And are they going to be terminated?
When the mandates come to our facility, yes. As far as I'm aware.
So up to half of the people that work at your facility could be gone, and the only people that will suffer are those that need care. The only people that will suffer, I mean, other than you, of course, if you're fired because you have a religious or a medical exemption, none of that matters, is what we're hearing consistently across the country. What is the one thing that you think is most important that the public is being lied to? Would you consider it to be the vaccine injuries? The floor is yours. I mean, just tell the world right now what the reality is from a frontline worker who has dealt with COVID patients from the beginning and still deal with this media craze, and you're seeing the truth firsthand. What do you want the entire world to know?
I want the world to stop watching the news. It is absolutely false. It is creating a false fear. I would go through COVID, the actual initial part of this 10 times over easily compared to what I have seen with this vaccine rollout. The injuries and the loss of life and the loss of function. People are walking into the hospital with breathing issues, and a lot of these people are not going out. They're not leaving. People with normal levels of life that were actually caregivers to their family are coming in, and they're changed forever, and their family is now taking care of them. This is horrific. This vaccine rollout is a nightmare, and the media is completely not telling the public any truth to what is actually going on with these vaccines.
Are the doctors pushing this vaccine? on the
Yes.
patients that are there?
Yes. And what's sad is the doctors are very aware of the effects of these. They can't not see them. If staff like myself are aware, and we have nowhere near the level of education as these doctors and specialists, and they're pushing these on, and when you question them, you're shut down. It's a nightmare.
Why do you think that is? Do you think that these doctors are being paid? Are they being threatened? Where is this protocol coming from?
We have no idea. We just know it is an unwritten rule. You can't talk about it. And they are pushing it at levels I've never seen. And the administration's pushing it on the staff. None of this makes sense. Why you knowing the results of these, and the staff that's awake, we see, none of us are going to take these. We see what it's doing to patients. We're helpless.
So doctors swear what we know as a Hippocratic oath, to where when they enter the patient's home, they serve only the patient. So if prior to this entire pandemic, if somebody were to come into your hospital, broken leg, heart attack, stroke, kidney failure, liver disease, pancreas issues, whatever it is, the doctor would have treated them, found any way that they could possibly heal this person and make them better. When the coronavirus, COVID-19 first came here, we were under the presumption that care providers were looking for ways to treat these patients. Since the inception of this vaccine, these shots, it now seems that doctors not only are not performing or living up to their Hippocratic oath, but they're actually contradicting it blatantly right out in the wide open and actually acting in a way that hurts or kills patients.
Yes. I no longer trust doctors' care. I'm there for the patient, and I'm literally having to point out to some of these patients that these vaccines are the reason why they're in there. Some of these patients have come in after only one dose, and they're being talked into getting the second one when they leave the hospital. I mean, it's insane. I have to tell these patients, do not get the second dose.
Well, I'm thankful that you're doing that. And I know that the families of these people that are very vulnerable, I mean, they're in the hospital begging for help, being isolated away from their families, no contact, no advocates, being denied the right to try, being denied the treatment that they're requesting, and basically given a death sentence. This looks like murder for money to me. I really appreciate your bravery, and I know the reasons why you can't come forward, and I respect that. When this thing is all over, people like you will be on the right side of history. Sarah, and I know that's not your real name, but thank you very much for coming forward and for telling the truth. We appreciate it.
Thank you for everything you do.
The lies are continuing. Natural immunity, obviously the way to go, and you can help to supplement that with protocols, early treatment protocols. Dr. Zev Zelenko, here's my PSA for him today. I promised you that I would give you this daily. Go to zstackprotocol.com. It has the quercetin in it, which is the gun, and then it has the zinc in it, which is the bullet. It's the COVID killer. Dr. Zev Zelenko saved 99.9% of high-risk COVID patients under his care. Thousands of patients in upstate New York were successfully treated by Dr. Zev Zelenko. So here's my PSA for you, my reminder of the day. Go to zstackprotocol.com. Go to zstackprotocol.com. Check it out for yourself. Go to zstackprotocol.com and stay healthy.